In this panel, I'm joined by my colleagues who are going to help us take a look at the evidence base for the health benefits of the arts. And I'm joined by, to my far left, Joka Brett, who's professor and program director of the PhD in Creative Arts Therapies and a board-certified music therapist. Her federally funded research has focused on the use of music therapy for chronic pain and symptom management. And next to Joka is Dr. Raquel Chapin-Stevenson, coordinator of the art therapy program at Lesley University and author of the recently published book, Art Therapy and Creative Aging. Welcome, Raquel. And next to Raquel, for us anyway, is Dr. Emmeline Edwards, director of the Division of Extramural Research at the National Center for Complementary and Integrative Health. Welcome, Emmeline. And finally, we have Dr. Rainbow Ho, who's an Associate Dean of the Faculty of Social Sciences, Professor of the Department of Social Work and Social Administration, and Director of the Center on Behavioral Health and the Master of Expressive Arts Therapy at the University of Hong Kong. We also have Dr. Daisy Fancourt, Associate Professor of Psychobiology and Epidemiology at University College London, and she'll be joining us by video. Welcome, all of you, and I just want to give a special welcome to Dr. Rainbow Ho, who's joining us at a really difficult hour in Hong Kong. So thank you so much. I'm going to start with this question of why we need evidence. Why do we need the evidence? And then we're going to continue with finding a bit more about what you're focusing on in your own research. But would anyone take that question for anyone who might be curious?
I can start us off. I think, as we already heard earlier this morning, we do need the evidence, right? Because the numbers count in terms of getting people to believe that the arts work. I think all of us in this room know that the arts work. And we were talking actually early this morning when we arrived, do we still have to argue, why we need to be doing this? And maybe not, but unfortunately for especially in the US, for reimbursements to happen, for services, for policy to be affected, there needs to be evidence, which is often understood as numbers, as quantitative data. However, as was alluded to before this morning as well, it is equally important that we have the stories that accompany those numbers, because I'm thinking of many policymakers who may need to have the numbers to make, an argument or a case, but they also need to hear the stories, and I think it's the stories that is going to stay with those people who might be influencers, who might be able to affect change at a policy level, and they'll need the numbers to back it up. But the stories will be probably what they bring to their constituents to tell, why it is important. So I think bringing the story and the numbers together, for example, through mixed methods research, is so important.
And you've spoken about two things there, really, in terms of both why we need it, which absolutely we've been talking about since the beginning of the day, but you've also highlighted, Joka, different kinds of evidence, right? The numbers and the stories, the images, the symbols. What would you like to add?
I think we've seen actually a lot of evidence today in the performances on the stage and the videos that that's all evidence too. I know I've had an emotional response to these performances, these art pieces, as evidence that as part of the human condition that we have a response, we have a reaction, we know that there's something there. And related to the stories, it is part of our stories, it's part of our humanity, but I believe that is equally as valid evidence that we really need to have, and part of tying together the stories, but connecting us to why we're doing this in the first place.
Thank you, Raquel.
Can I just add something?
Emmeline, yes, please. Maybe
I totally agree with what Joka was telling us about not only the stories and the numbers, but we also have to remember that in order for us to actually actualize utilizing the art, music and other art forms and incorporating that into healthcare, we really need to build the evidence for rigorous and replicable studies. And that's what the National Institute of Health is involved in doing currently through the Sound Health Initiative. This is a partnership between the National Institute of Health, or the NIH, and the Kennedy Center for the Performing Arts in collaboration with the National Endowment of the Arts. It's really building this evidence, providing support for researchers and practitioners of the arts to come together to actually do research in a rigorous way with large sample size so that we can actually present that evidence and make sure that we can scale that work and convince policymakers that there is a premise for using the arts in health.
Thank you, Emily, and you've actually brought us already into some of the work that you're doing. And so I'm going to ask us to do this, ask the rest of our panelists to do the same and to, in a way, bring us into your own lab. Rainbow, I'm going to come to you first to tell us a little bit about the research that you're actively involved with now. And so over to you.
Oh, thank you very much. Hi, actually, it's my honor to join you virtually while I'm physically in other half of the world. In Hong Kong, I have conducted several research projects to measure the psychological and physiological benefits of art-based intervention, as I always believe that arts can promote holistic well-being in different populations. In a clinical trial with older adults with mild dementia, we found that dance movement therapy could significantly reduce the negative mood, depression, and sense of loneliness. It also helped improve their daily functioning, memory, and helped them regulate their stress hormone cortisol. Cortisol is in fact the hormone that plays an important role in our body immunity and a lot of other functions. We observed similar results in another trial with breast cancer patients. Dance movement therapy could help reduce their perceived stress and regulate their stress hormone cortisol level. And more importantly, we found that after joining the program, patients feel their pain less disturbing and more tolerable. And recently, we also completed a project using expressive art therapy with community older adults with depressive symptoms. Expressive therapy uses different arts modalities like music, visual arts, dance, drama, and expressive writing. We found that the depressive symptoms were significantly reduced and quality of life was significantly improved in older adults after joining the program. Expressive therapy could also help other populations, like adults with intellectual challenges, adults with HIV, and also survivors of the earthquake. We are currently working with young stroke survivors using art-based intervention. Apart from looking at whether the program can enhance their mood and quality of life, we also want to understand if the program can help them rebuild their internal connection with their bodies. Since many stroke survivors lost their control and sensation with some body parts, some participants told us that after the intervention, they could feel their affected body parts having more energy flow. As you may be able to see in the images showed on the slides, the colors they use for their bodies after the intervention are different and richer. So in sum, our several clinical trials demonstrated concretely that art-based intervention produce not only psychosocial benefits, but also physiological benefits. Yeah, thank you, Nehas, for the invitation. And I'm glad to talk more about this if I have time.
Thank you so much, Rainbow. And you spoke a little bit about pain reduction, so I'm actually going to pass this directly over to Yoka. I know this is an area of expertise for you.
Yeah, thank you. So I think what we're doing at our lab, the Music, Creativity and Wellness Lab, is really living into what Emmeline was just talking about, really building these larger, rigorous trials and systematically building from small feasibility studies and really consistent research program. And indeed, our work is mostly focused on music therapy for chronic pain management. So we are, thanks to funding by the NIH as well as the NEA, like the NEA Research Lab that Sunil was mentioning this morning, we are recipient of their funding for that work. So through that funding, we are able to do that, doing these large-scale, multi-site, rigorous trials to get to the high-quality evidence. And then on the other side, in our lab, we're doing a lot of work on trying to summarize the evidence of large randomized controlled trials, which is equally important. So we are conducting a lot of Cochrane systematic reviews on music interventions for various populations, such as people with cancer or people with coronary heart disease and mechanical ventilation and so on. So we're trying to put out trials that show that music therapy works as an intervention for a particular health problem, as well as trying to summarize the evidence that is out there.
Thank you so much. And can I ask you, Yoka, just to elaborate just a little bit more in terms of, for the layperson interested in how music might reduce pain, how would you describe it?
Oh, we just had a conversation about that on lunch, during lunch. So my work is mostly focused on chronic pain management, and in chronic pain, it's much more than just addressing or using music for pain reduction. Music can do that, right? Music has, as we heard this morning already, has wonderful, can create wonderful mechanical reactions in your brain, such as increased dopamine, which has an impact on your sense of pain perception. But chronic pain is so much more complex than just the pain intensity. Most people with chronic pain will continue to have chronic pain, but chronic pain often has had a devastating impact on their life world, on their psychosocial reality. So in the therapy sessions, there's also a lot of psychotherapeutic work that happens through music, trying to address some of the negative impacts that chronic pain has had on these people's lives. And by doing so, you build their resilience to be able to live with chronic pain. So we always tell people who participate in our trials, music therapy is not going to take away the pain, but hopefully music therapy will help you live your life the fullest with chronic pain.
Thank you. And I'm thinking about living a good quality of life with or without pain. And, Raquel, this is where your work really comes in. You've really been looking at art across the lifespan and specifically with older adults. Can you tell us a bit more about what you have been researching and what you found?
Sure, thank you. So my work has been at the intersection of arts and aging, in particular creative aging. So really looking at how arts engagement can help improve the life and well-being, the health and well-being of older people. So some of the things that I have found is that the arts really are helping people to stay connected, either to themselves or to other people. And we know, unfortunately, so much that many older people are really at risk of social isolation and loneliness. But making art together, it's a risk-taking experience, that experience can really bring people together. It has incredible rippling effects of their health and well-being. Not to mention feelings of motivation, that the arts engagement is something that's joyful, that people enjoy doing, so they're more motivated to go out and participate in these kinds of things, which, it's great to have a reason to get up and go. And I've also been looking more specifically at how particular arts media and the application of them can really be tailored to the unique needs of older people. So whether, we know, we're learning fortunately more and more about how there are unique developmental moments that happen as we age, and also brain functioning. We're learning how an older brain uses the left and the right hemisphere much more in a unified kind of way, which really leads to enhanced possibilities for creativity. So there's all these pathways that are showing us how older people really have a great capacity for creativity. So we have a great opportunity here to bring the arts with older people to really help with their health and well-being, from people who are, looking for something to do in their life and trying to maybe learn to paint for the first time. So it's more like a lifelong learning kind of a process, to someone who maybe is very isolated or even has dementia and is disconnected from their verbal aspect of their life, that we can use the arts as a new form of communication and bridging those gaps and making new connections.
In the area of dementia, our consortium of researchers around the world, including from Drexel, from Leslie, from Edgehill, University of Haifa, and Alanis, and so on, have been pulling together the research through a systematic review of reviews, specifically in the area of dementia, as a means of guiding policy in our partnership with the WHO, and seems to be making some progress there. So there's some really exciting work to return to. I'm going to return to you, though, for the moment, Emmeline. You have a really unique vantage point at the NIH, and I wonder if you could speak about some of the trends that you're noticing with regards to research in the arts and health.
So essentially, as I mentioned earlier, we are in the process of really increasing the research portfolio in the context of arts and health. At the NIH, from the outset, we decided to focus primarily on music right now, although we will expand at some, at the later date. So most of the work that we're currently funding is focused on the basic and mechanistic aspect of how music impacts the brain, how it's processed in the brain, and how it influences different physiological systems. So we also have a portfolio that's focused on arts and healing. So we do have a number of projects that are looking not only at the impact of music on chronic pain, but also on in Parkinson's disease, how to actually improve not only the gait, but the stability of gaits of Parkinson patients. We have work that is funded looking at the impact of music on cardiac biomarkers such as endothelial function with from singing interventions. We have also work that's focused on psychosis and how utilizing some of the principle of music, which is really aspect of prediction, can actually help correct the dysfunction that people that experience psychosis have in their perception of themselves and also their perception of others. So we really have a broad, span of different disorders and also various aspects of basic and mechanistic music that we're currently funding at the NIH. So I can talk about this a little later, but I would also like to say that as the director of extramural research at the National Center for Complementary and Integrative Health at the NIH, we're very much interested in the concept of whole person health. And really, arts and health fits perfectly with that vision because music or other art forms really utilizes both psychological and physical input, therapeutic input. And so they are part of our toolbox in the context of mind and body approaches at NCCIH.
I think, overall, the day so far has really affirmed that we are not talking about whether the arts can heal. We're talking, again, about how and the specifics of with who and when, under what conditions. And the conversation has been moving. And one of the researchers who's really helped to move that conversation along, at a global scale has been Daisy Fancourt, who led the first comprehensive report on the health benefits of the arts through the WHO Europe office. And she joins us by video. If we could have that video now.
Hello, I'm Dr. Daisy Fancourt, and it's lovely to be joining you today. Over the past few years, I've had the pleasure of working with WHO to explore the breadth and depth of the evidence base on arts, culture, heritage, and health. And I want to talk to you about the report that we published in 2019, which is the most comprehensive scoping review to date of this literature. The report has shown us an enormous body of work from studies carried out internationally. Our report references over 900 publications, including 200 reviews that themselves cover another 3,000 studies. This includes peer-reviewed studies, but also there's a grey literature beyond our report that's gathering more and more evidence every month. Notably, the ways that the arts have been shown to affect health are incredibly broad-ranging. People most commonly think about arts and health as meaning the role of the arts in treating or managing mental or physical health problems, from mental illness to neurodevelopmental and neurological disorders and non-communicable diseases, and also supporting the delivery of acute care and palliative care. But actually, there's also a sizable literature showing the role of the arts in the prevention of ill health and in wider health promotion, from the arts affecting social determinants of health, supporting child development, encouraging health-promoting behaviours, playing a role in health communication, and helping to prevent the development of mental and physical illness, and supporting caregiving. Of course, a key question is around the quality of this evidence base. When we look at the collective body of evidence as a whole on arts and health, some topics are well researched with dozens of clinical trials enriched by qualitative and ethnographic studies. as well as laboratory experiments and epidemiological analyses. But other topics have had just one or two preliminary studies. So whilst there's clearly huge promise in further pursuing this topic, we need to make sure that we're levelling the playing field by investing in some of those areas that have had less attention. And we also need to make sure that we're drawing as much as possible on interdisciplinary research tools with cutting-edge methods, from imaging to physiological monitoring to psychological testing to creative methods and biological analyses. The report also finds that the arts may play a role in providing multi-sectoral, holistic and integrated people-centred care, particularly helping to address complex challenges for which there aren't currently healthcare solutions. As such, the arts could actually help countries to reach some of their integrated targets for key global frameworks, such as the 2030 Agenda for Sustainable Development and the WHO General Programme of Work. And in the report, we include a number of case studies from every continent in the world showing some of the fantastic practice that's already going on. The report focuses on arts engagement and health outcomes, the start and end points, but we need to understand more about the middle too. So since publishing the report, we've been working further on this with several new projects. First, what is it about the arts that mean they have the potential to affect health? What are the active ingredients they contain? How do these ingredients align or differ from other health promoting activities like physical activity, psychological therapies, etc.? We're just completing a project at UCL mapping these ingredients and showing the complexity of arts as activities, which we'll be publishing this autumn. Second, how do these ingredients trigger different psychological, biological, social and behavioural mechanisms linked to health outcomes? We've recently published a paper in the Lancet Psychiatry identifying over 600 mechanisms that have been proposed to explain this link between arts, leisure and health. These come from disciplines including psychology, biology, ecology, occupational therapy, medicine and philosophy. And we need to be using these ingredients a lot more, these mechanisms a lot more within our studies. Third, why is it that some people appear to benefit more from arts engagement than others? What factors moderate how the arts affect us? It's frequently stated that the arts are complex interventions, but we need to move beyond this just as a label and start to understand how this complexity operates in practice. So we're currently developing new theory using complexity science on the arts-health relationship that we'll be releasing soon. Finally, we have to understand how activities work, not just in research settings, but in the real world. We need more process evaluation, studies of implementation, to understand what makes an intervention successful, sustainable. How do we scale programs so they can reach more people, but so that they stay appropriate and tailored to their local environments? We also need to understand more about investing in the arts and the economic impact of this investment, not just for arts itself, but also for health outcomes. We're currently working on more work with WHO looking at this issue of implementation that we're looking forward to sharing with you. So to conclude, the report shows that we have a phenomenal platform to work from, but really the most exciting work I think is still to come, as it's in the detail that I've just outlined that we have the potential to understand and learn the most about this really remarkable relationship between arts and our health. Thank you.
Thank you so much, Daisy. So Daisy's outlined a number of directions where she thinks this work needs to go with regards to examining therapeutic mechanisms, indicators, moderators, the economic impact of investing in the arts and health, and thinking about scalability, cultural contextuality in this work. And I think I'm just going to end by asking you this question. Where do we need to go as a research community in advancing this work? Who would like to begin? Emmeline, I'm going to turn to you as you can't see me. Where do you think we need to go with regards to research in the arts and health?
Did you ask me a question, Nisha?
Yes, I'm going to try it again.
Okay.
Where do you think we need to go with regards to research in the arts and health?
So I can, we're doing this in two ways. The first one is that this past year at the NIH, we partnered with the Foundation for the NIH and the Renee Fleming Foundation to actually work to develop what we're calling the NIH Music-Based Intervention Toolkit. This is really a primer or how to do music-based intervention. What we have found is that the studies that are out there are usually fairly small and are not grounded in a good mechanism-based approach. So what we've been working for over a year with a multidisciplinary group that was composed of music therapists or music medicine professionals, neuroscientists, behavioral intervention developers, clinical trial methodologists, uh, art advocacy representative, and music, the Music Therapy Association representative. So we've worked for over a year to talk about the building blocks of music-based intervention, some core data set of mechanistic and clinical outcome measures, and also biomarkers that would be linked to the clinical outcomes. So we're in the process of publishing this material. And so once this is done, then we can actually test that toolkit. And that's what we're hoping to do in the next 2 to 3 years. Through funding opportunities, we would actually support research from a from multidisciplinary team to actually test the principles that we are putting forth in the toolkit. The second thing that we are doing is also an effort between the NIH and a number of academic researchers to improve the reporting guidelines for music-based intervention. And with that, we are in the process of putting together some working groups that would include researchers, practitioners, journal editors, consumers, to come together and actually agree upon most appropriate guidelines to report the outcomes of those interventions. Because it's really very uneven right now, and it's very difficult to reproduce or to replicate studies because people are not actually describing their experiment in a total and complete way. So those are two efforts that we're currently doing in order to improve the quality of the research and to actually move the field forward. Because what I'll say, what our ultimate goal is to make sure that art-based interventions are incorporated into healthcare so that someday, hopefully not too far, we will be able to do like the UK and have social prescribing of art-based intervention.
Thank you, Emmeline. Yuka, would you like to add to that?
Yeah, I would like to add actually two things that one that I think we need to move forward to and one that we have to be careful for. And I'll start with the one that we have to be careful for, and that is in our attempt to conduct rigorous research and mechanistic trials and begin to dismantle what Daisy was referring to, what are the active ingredients, what are maybe non-essential ingredients in the intervention. I think we have to be really careful when we look at researching the impact of the creative arts therapies, and I'll give music as an example. We need to be very careful that we are examining creative arts therapies, meaning what I see happening in music therapy research is that there are quite a bit of studies out there that are trying to standardize the music stimulus, right, to make it equal across all your research participants. Or the standardization of music stimuli is very important in brain imaging research, for example. And so that research is very important. However, in music therapy, music therapy is not music as a standardized stimulus plus relationship or plus therapy. It is the actualization of growth and personal insight that happens through active engagement with music in a therapeutic relationship. So it's very, very hard to dismantle that, because the moment you dismantle that, you're actually breaking a very important relationship. So I think we need to be very mindful of that. And then where we need to move forward as well, besides what the NIH is doing with their wonderful initiative on creating that toolkit and making sure we have rigorous trials, is to use systematic reviews like the one Daisy did, the one we're doing with the Cochrane reviews, to know where we need to go in certain areas. And I'm going to, sorry, I keep speaking of music therapy examples because that's where my research is. But for example, in music therapy, we just completed a Cochrane review with over 80 trials on music interventions with cancer patients. And we know from that Cochrane review that music reduces anxiety in cancer patients. We really don't need single trials anymore that look at does music improve? We don't need to waste funding there, except in that particular area, we are ready to move to large comparative effectiveness trials. So do we dare, in those areas for which we have sufficient evidence, do we dare to move forward to comparative effectiveness trials? And for people in the audience who are not researchers, that means, can we compare the creative arts therapy intervention, such as music therapy, with another intervention that is typically used for a particular problem? So we're about to start a large comparative effectiveness trial that is funded by PCORI to compare music therapy head-on-head with cognitive behavioral therapy for anxiety reduction in cancer survivors. So, those comparative effectiveness trials, they cost a lot of money, but that is where we will need to move forward in the areas where we have sufficient evidence.
And I hope what comes across too is that this can be really granular. It's just moving something forward little bit by bit and building on each other's work that we don't always have access to, and that's a conversation for another time in terms of making knowledge more accessible. I'm also noting the time, and this is a longer conversation, but unfortunately I do need to wrap it up in order for us to give space to all of the wonderful presentations we have in this program. So at this point, I'm just going to say thank you to all of our wonderful panelists. Thank you so much for the work that you are doing and for making time to be here.
Thank you.
Thank you.
Thank you. Thank you.